Hey guys, it's Dr. Abraham with A Sip of Aesthetics. Today I'm here with Key. Hello.
Hi, everybody.
Good to have you here on the show.
Thank you.
We're going to be talking a little bit about the CO2 laser today, a very popular topic. Um, I think many of our listeners have heard of the CO2, but if you haven't, that would be a good kind of introduction-like video. We'll talk about what a CO2 laser is, what it's used for, who would be a good candidate, all that kind of stuff.
Okay. So we actually got a new one here at New Med Spa, and it's called the DECA. And it's great because unlike old traditional lasers, like the CO2 lasers, where you go in and you get your entire face burned off and you're like hiding for about 2 weeks, this one is really non-ablative. It takes about like 30 minutes to like an hour to do. And the recovery time is about 5 days. And it's almost like a light peel. And it's FDA approved for acne scarring, fine lines and wrinkles, texture issues, elastin production, collagen production, like you name it, it does it. So it's one of my newest procedures to do that I really like just because the downtime is substantially so much lower than before.
Perfect. Now, there are, I think part of what you're referring to is some of the older CO2
Yeah.
lasers were non-fractional, so they would kind of get the whole
Yeah.
piece of skin, whereas because some of these lasers are now fractional, like it kind of goes after a specific, like small dot in the skin and then kind of leaves the surrounding tissue, give it time to heal, so it kind of speeds up the healing time, but you're still targeting, the skin.
Yeah, it
As you go
creates
through it.
little micro channels into the epidermis of the skin and it goes into the dermal layer, but it preserves a lot of the skin around it, unlike the traditional lasers where they just burned off a layer of your skin, right? So it's
Sure.
pretty much a third-degree burn versus this, it's a non-ablative fractional laser. So unlike the old lasers, this new laser, it is a fractional ablative laser, which it doesn't ruin the entire skin integrity. It just creates microchannels. So the healing time and the downtime is a lot lower.
Awesome. Yeah, and that was one of the main thing with the older CO2 laser. You do get great results, but just the downtime is just crazy. Yeah, and I think that's one of the great things about these newer laser because like the old non-fractional ones were great. You see great results, but then just the downtime's brutal. And who wanted to deal with this whole downtime? But now you get less downtime, but you can still get great results. So just to kind of backtrack a little bit, who do you think would be a good candidate? Like what kind of clients do you see in your practice where you're like, you know what, you might be a good candidate for this laser. You should consider a CO2 treatment.
So a lot of patients that love the sun, right? They would go out and bake in oil, and their skin now is like you can make a purse out of it. Maybe an Hermes. But they would benefit from it because their skin is so tough and nothing can get through to their skin. So you really do have to remove a layer and get down to that, all the age spots, the sunspots, the crazy damage with the thickened skin. And it helps remodel the collagen and elastin underneath the dermis. So they can have better, smoother skin texture, brighter skin, and also just tighter and smoother skin as well.
Perfect. And one of the things I also love about these lasers is that you can, like as we mentioned, the downtime is generally speaking much less than with
Yeah.
the older ones, but you also have more of a degree of a control where you can go with like a lighter treatment where maybe for somebody who doesn't need as much improvement or somebody who's willing to do multiple treatments,
Yeah.
somebody who wants to start a little earlier, but you can go more aggressive. Like you can definitely still go a little aggressive with these lasers for somebody who's willing to go through some, a little bit of a longer downtime and needs more, a more aggressive treatment.
Yeah, like I think one of our coworkers here, they did it, and the downtime was like a day, and you couldn't even tell that they did anything. It just they look kind of. So after the laser, The main complaint is that you get a little bit swollen, like a little bit red, right? So you're just swollen and red. You can cover it with makeup or wear a hat, wear sun protection, but you're not blistering, you're not peeling, you're not having to, hide your face from all your coworkers, right? No one's gonna really be judging you. It's just you're just a little bit red and swollen. That's it.
Awesome.
Yeah.
And if you wanted to go more aggressive and you had more downtime, like if you're like, I don't care if I look like,
Yeah.
really red and swollen for a week, would you be able to go more aggressive?
For sure. Do it on like, I don't know, like an MLK weekend or something. Like,
For sure.
where you have
Right,
some
yeah.
days off. But yeah, you can go super light or super aggressive. It really depends on your downtime.
And anything in between.
Yeah, anything in between.
Have you seen like good results with it? Do you like this laser? Is that, or do you prefer like other treatment modalities for most people?
If you have the downtime and you don't really care about being swollen, definitely choose a CO2 laser. I personally love it because I have a skin type 4. I'm Asian, and I can't do the traditional lasers like the IPLs because I tend to hyperpigment. Versus the CO2 laser, it's safe for my skin.
Especially the, fractional one, especially that you can control the power
Yeah,
of the settings and stuff.
exactly, right? It can help remove my sunspots, which IPLs they can't do it on me because they make it darker for me. Like especially my melasma as well. That's just how my skin type is. So I personally really love it.
And that's one of the things I actually like about these CO2 laser is that they're pretty versatile. So you can do like a lot of sun damage treatment with them. Like there are treatments where they might be like good for collagen production, but they don't treat like, let's say, the dark spots as well. Or there are other treatments that are good for dark spots but might not improve the texture of the skin.
Yeah.
But the CO2 can do a little bit of
Everything.
everything when it comes to these kind of symptoms. Which
Yeah,
is,
because so you don't have to pick and choose, right? You don't have to be like, oh, well, I just want my sunspots gone, or I just want my fine lines and wrinkles. Like this is the Cadillac. You get everything done at one time.
Yeah.
With the same downtime as any other lasers.
Perfect. So if somebody's listening to us and they're like, yeah, I kind of want to give this a try, and obviously you want to make sure you are a good candidate, you talk to your provider, but what should they expect in terms of like, when do you see the results? Is it something where it's like immediate, where you see the full effects, or do you want to give it time to get the full results?
So your skin heals after 24 hours, and then about 5 days to 7 days, that's the downtime, but you should start to see results in about 3 to 6 weeks, and that's when the collagen's building, the elastin's building, right? And you have that skin rejuvenation. And then as for how many sessions you want to do, I would start with one. If you want to go more aggressive, right? It depends and it varies on patients, but like on you or me, I would do like maybe a light setting and maybe once or twice a year, or just once a year.
Gotcha.
That.
Yeah. And kind of as you're saying there, like the amount of sessions will depend on each person, but also on how aggressive or how light you're going, right? You might need more of the light treatments,
Yeah.
but as opposed to like less aggressive treatments, but then again, you're not dealing with the same downtime. Yeah. The other thing too is like with these lasers, it's just like, it's a great tool to have, but just another tool, in the toolbox, right? Not everybody's gonna be the perfect. It's not gonna be the perfect treatment for every person.
Yeah.
Some persons might need a different type of laser. Some maybe for another person, IPL is the right answer, or a pico laser or resurfacing. But it's definitely a great tool to have, and for anybody who's listening, like the best way is probably to go to a place where they offer all these different types of laser and kind of see, get that consultation and see what's the best treatment that's going to be personalized for them.
Yeah, and over here we offer free consultations. So all you need to do is just like call and book us, and you can see me, you can see other providers here. But we like to look at you, inspect you in person, and then we can go from there and establish a kind of like a patient care procedure, and just go from there.
Yeah, and that's why you want to be informed about all these treatments and all the different options. But like, this podcast or any other like thing you read online is it's not gonna be a replacement to getting that personalized consultation with somebody who does these treatments.
Yeah.
But you also want to know what tools could be available for you, so that when you go in with the right questions, maybe you go in with the right idea, and you discuss it with your provider, and they might be like, yeah, you know what, you would be a great candidate. That's a great idea. Let's do this laser. Or it might be that, you know what, no, like I think for you we should do something else.
Yes, I completely agree.
Now, in terms of preparation, what do they have? Like, what do you tell your clients to do to prepare? Because, like, that also affects when the best time for some clients to do it with the
Yeah.
sun exposure and all that stuff.
Well, good thing in California over here, we do
Yeah.
have pretty nice weather, so it's hard to do it, year round. But I would suggest doing it in a time when you're not outdoors, you're not going on vacation, right? You do have about a week or two where you can wear hats, you can wear sun protection, you're not out in the sun blazing. And then as for the downtime, right, just give it about 4 to 5 days of that healing time. And then just make sure that you take care of your skin and keep it hydrated. So after the procedure, you do want to make sure it's get that dressing on there and that hydration barrier. So like Aquaphor, Vaseline, you keep that on there so your skin can heal and it won't actually scar during the healing process.
Yeah. And the more aggressive you go, the more you'll need to take care of it in a sense, versus a light peel, as you've mentioned. It would be a lot easier. And you might, because just like most lasers, you do want to avoid the sun exposure before and after the treatment. So just something to keep in mind when it comes to doing these types of treatment, especially again if you are going to the very aggressive treatment. Whereas if you're doing a lighter treatment, you still can do that, like probably in the summer, as long as you're taking care of your skin, paying attention to the sun, avoiding too much sun exposure, wearing your sunscreen. But if you really wanted to go with the more aggressive treatment, and honestly, a protocol that I've seen like a lot of people do and people happy with is kind of doing that more aggressive treatment initially, just to kind of kickstart things, and then kind of maintaining with a bit of a lighter treatment. But sometimes people do love to go like, a little bit more aggressively initially, and kind of deal with that downtime, as you've mentioned, especially when they're able to time it. But then maintenance becomes a little bit easier.
For sure. And just wear like a big hat, right? They have it on Amazon. So, since the sun is the enemy during the healing process, January, February, March, right? We're kind of in the winter months. This is the perfect time to do it. And you'll be able to really avoid that, really heat, the humidity, along with the crazy sun exposure during the summer months.
Yeah, I completely agree. And even if you are outside on a cloudy day, you want to make sure you're still using sunscreen. But this is laser season, so make sure you don't come on in, especially if you're in this area. Take advantage of that free consultation if you're in the Westlake Village, Encino, Los Angeles area. But thank you guys for listening. Come back next week for the next episode. Make sure you like, subscribe, and let us know of any other topics you want us to talk about. Have a great one. Thanks, Keith, for coming.